There's 500 million people on this planet that have diabetes. And there's another 500 million who have prediabetes. The general public doesn't look at a diabetic foot ulcer as life-threatening. But when you look at the statistics worldwide, an ulcer happens every second somewhere to somebody on this planet. Now we're looking at 100 million people are going to develop a foot ulcer in their lifetime. And 85% of all lower extremity amputations are preceded by a foot ulcer. So here's the leverage.
Welcome to the Fountain of Vitality podcast. I'm your host, LaMont Leavitt. In a world overflowing with noise, confusion, and distraction, we're here to cut through the clutter and explore bold, unique paths to a longer, healthier, and more vibrant life. Through candid conversations with business leaders, wellness experts, industry pioneers, and innovators, we'll uncover insights to help you discover your own personalized, unique approach to thriving. Tune in, trust the compass of wisdom within, and find your fountain of vitality. Hello, my name is LaMont Leavitt, and welcome today to the Fountain of Vitality podcast. We're thrilled today to have with us Mark Hinkes. He's been a podiatrist for over 42 years. Doing the math on that, of 15 visits a day, that comes out to about 200,000 appointments. So I think he's seen plenty and is definitely qualified today to talk to us about feet and legs and how to keep the legs that you stand on. Dr. Hinkes, thank you for joining us today.
Thank you, Lamont. It's my pleasure to be with you today.
Our listeners would love to hear some of your stories of the things you've learned, and tell me in the past where you've been and how you want to spend the rest of your life helping people.
Okay. Thanks for that opportunity. Believe it or not, this journey that I was on started because of Hurricane Andrew in Miami in 1993. I had $1 million practice, a beautiful home, a little swimming pool in the back, which I enjoyed. The hurricane came, I lost everything. I lost my business. I lost my home. I lost its contents. I had a message that it was time for me to leave Miami. I ended up going to Roanoke, Virginia to work in the VA hospital there, where I spent 5 years. And just as a quick story, when I got to Roanoke, I became the director of podiatry services, and more importantly, the chairman of the Preservation, Amputation, Care, and Treatment PACT program. So this is a government program where they suggest that we identify people that have lost a leg and prevent them from losing the second leg. Well, I came from a podiatry practice of sports medicine, surgery, biomechanics, not too many people with diabetes. I literally had to teach myself from the start about this. When I got there, when I went into the reception room, and it was a pretty good sized room, I was in shock. I had never seen so many people with one leg in one room in my life. And I thought to myself, Mark, you're in trouble. So, it was a blessing in disguise because it forced me to, become very knowledgeable, to be able to treat these people and help to prevent them from losing their second leg. And I learned a lot. I helped a lot of people. There were some people I was not able to help, and I always felt badly about them. Unfortunately, there are some people with diabetes whose condition is so difficult that a foot ulcer or loss of a leg is an outward manifestation of how bad their body is, the shape it's in. And I have had more than one or two patients who in the middle of my treatment regime passed away.
Wow.
And that is very, very disturbing to me. No doctor wants to lose a patient, especially because of a foot problem, but it does happen. So anyway, I stayed in Roanoke in the Blue Ridge Mountains for 5 years. I loved that. And then moved to Nashville, where I took on the same position, but in a bigger facility. And in Nashville, in chairing this program, I began to see quite a few patients, many more patients than I saw in the other facility. And I did a research project. And what I did was I tried to use the precepts of the American Diabetes Association combined with the International Working Group on Diabetic Foot. So I had a risk a risk engine, and I had a comprehensive examination engine. And I put those two together, and I started doing research for me so I could see if using evidence-based medicine was going to really make a difference. And after 5 years, we ran the numbers. And what I found was amputations were decreased by 40%. Costs were decreased by 62%. Well, I was quite astounded. And from that experience, now that I've retired in 2019 after 42 years of service. It took me about a year to kind of unwind from actually, going to the office and do all this. But I decided, LaMont, when I had one person in my chair, I knew I could help them. But then I thought, what about the millions of people around the world who have diabetes? There's 500 million people on this planet that have diabetes. And there's another 500 million who have prediabetes. And I began to think, who's going to help those people? Are they going to have access to podiatry or vascular surgery or wound care or a doctor that just knows what's going on that could help them? And sadly, I came to the conclusion that they weren't going to have anybody to help them. If you look at the numbers, if you look at what's going on in the world today, too many people are getting up in the morning or getting home and taking their sock off and seeing a stain on the bottom of their sock. And when they take the sock off, they see a hole in their foot. And they don't know why. I didn't step on anything. I didn't do anything unusual. I don't have any pain. I don't understand what happened. And all of a sudden, they got a nightmare on their hands. This is not a dream for them. They have a nightmare because now they have a problem that could be life-threatening. And people don't, the general public doesn't look at a diabetic foot ulcer as life-threatening. But when you look at the statistics worldwide, an ulcer happens every second somewhere to somebody on this planet. And there's a lower extremity amputation done every 20 seconds to someone somewhere on this planet. So LaMont, in the last minute when you and I have been chatting, there have been 60 ulcers and 3 amputations.
Wow.
So I decided, I'm a dreamer. I decided I cannot let this go. We must find a better way. We have to find a better way for these people because in essence, 20% of all people with diabetes, and right now we're looking at 100 million people, are going to develop a foot ulcer in their lifetime. And 85% of all lower extremity amputations are preceded by a foot ulcer. So here's the leverage. If you prevent the ulcer, you prevent the infection, the emergency room visit, the hospitalization, the amputation, and in some cases, the premature death. My mission and my vision is to make the lives of millions of people who I will never meet or know better. And at the same time, by doing that, we'll also reduce the cost of healthcare. Who are the winners? Winners are the patients. Who are the losers? The losers are the pharmaceutical company, the medical device company, the hospital chains, and the guy or gal who wants to cut your leg off. I don't really care about them. That's their problem. I'm the champion of the patient.
Perfect. Now, so tell me on ulcers. So if the whole goal is to prevent the ulcers in the first place, you've been a podiatrist for years. What are some things that have worked well that you've seen or things that you see working well in the future?
Okay, let me explain basically how somebody gets an ulcer, and by doing that, I'll tell you how we can prevent it.
Okay.
People who run chronically elevated blood sugars develop vascular disease, and the hallmark of diabetes is known as it's a small vessel disease. The smallest little vessels, called arterioles, are the ones that become narrow or occluded, and these are the vessels that nourish the brain, the heart, the kidney, the eye, and the foot. And so after a while, when the blood sugars have been so elevated, those arteries become closed. And so the nerves don't get the fresh oxygenated blood and nutrients that they need. And the nerves start to malfunction. And so there are three types of malfunctions that can happen. One is called sensory neuropathy, one is motor neuropathy, and one is autonomic neuropathy. In plain English, sensory neuropathy means you can't feel the floor. If you step on a piece of glass, you won't feel it.
Yeah, I have a friend that has that, and
Yep.
he's described that's exactly what it's like.
Yep. Motor neuropathy involves difficulty walking. Some people fall and they develop deformities of their feet. The toes get curled up. And then autonomic neuropathy involves the automatic systems of the body. And relative to diabetes and what we're talking about, it results in dry skin, cracked skin, and fissures, which are portals of entry for infections. So with a vascular component, bad circulation, and a neurological component of these of the malfunctioning of the nerves, a third thing has to happen, and that is a triggering event of trauma. And the traumas are three varieties: mechanical, chemical, or thermal trauma. So, mechanical trauma can be any of a million ways, including you get up at night and don't put your slippers on, you end up nailing your foot against the doorway in your bathroom. You go to the refrigerator to get a bottle of ketchup and it drops on your foot. Your shoe is too tight. Your sock is not the right size. Just think about it. Anything that imposes a mechanical trauma on the foot. Chemical trauma comes from over-the-counter products that you can buy at the drugstore that contain salicylic acid. And we say acid has no brains. It eats anything you put it on, and that includes the good skin. So people that use these products are used for ingrown toenails and warts, but sometimes corns and calluses. And they are deadly for people with diabetes. Okay.
Oh, wow. I didn't even think of that. That's true.
Yeah. And go ahead.
No.
All right. And the third type of trauma is thermal trauma. And thermal trauma can be either heat or cold. And the story on thermal trauma is because these people have bad circulation, their feet are either objectively or subjectively cold. And so they are going to go to external heat sources: radiators, registers, hot water bottles, heating pads, fireplaces. And I've had more than one patient come to my office with a burn on their foot, a thermal burn. And what's the story? How did this happen? Well, inevitably, they say, my foot was cold, so I just laid it against the heating pad. I was going to only do it for 10 minutes, and I fell asleep.
It's too hot.
And they got a thermal burn. So this is how ulcers happen. So now you've got a hole in your foot, and now the situation is, what do we do to heal it? And this is very complex because each patient has unique risk factors. And some of those risk factors are vascular, and some of them are neurological, and some of them are musculoskeletal. Bone deformities like bunions, hammer toes, Taylor's bunions, which happen on the lateral side of the foot, hammer toe, mallet toe, claw toe, the various digital deformities, soft tissue deformities, which are corns, which are on the toes, or calluses, which are on the bottom of the foot, and thick and discolored toenails. And I've seen more than once, more than a lot. I've seen patients where they first of all, they can't see because they have retinopathy. Their eyes are affected because of the small vessel disease.
Sure.
And, they're using, I call them bathroom surgeons. They can't see. Their instruments aren't sterile. They don't have good light. They've got awful hand-eye coordination. And here's a guy that's going to try to trim his toenails. All right. So I've had more than one or two people come in where the bone was actually sticking out of the end of their toe. And I said, how did this happen? And he says, well, I was trimming my toenails. But they actually trimmed the end of their toe off, and the bone was sticking out.
Wow.
Okay. So there are, I guess I can put it into a big category. There are tragedies, and there is suffering that is just not to be believed. And so much of this problem comes from patients not being educated. And Well, there's a tremendous profession called certified diabetes educators whose mission is to educate people with diabetes about how to keep their blood sugars under control, how to eat right, how to practice preventive behaviors and such. Most people don't even get a referral from their primary care doctor to a certified diabetes educator. So what we have is one of the issues, and there's probably 3 or 4 or 5 major issues that go into this. But one of the issues is a lack of education on the patient's part, because patients don't understand why that guy that took his sock off and saw a hole in his foot, he didn't know why he has that. You and your listeners now know because I just told you.
Right.
All right. So if somebody would have just told him, that would have been different. But people don't know. And so it's this ignorance that kind of happens where they're not educated. And then the confounding part about this, LaMont, is that there's a group of people that say, no matter what I do, I'm going to have a problem. Or in spite of what I'm going to do, I'm going to have a problem. And I wrote a chapter in my book called Denial and Resignation, Two Ends of a Gray Rainbow. And that's what we're seeing. So the psychological aspects that people have what I call diabetes distress, where they fight the condition. They deny the condition. They won't do what's appropriate to manage the condition.
Do you see pride sometimes where they just don't want to tell anybody, keep them from becoming healthy because they just don't want to deal with it? They don't want to tell anybody. And
well, it's not a question of not telling. It's just they don't want to be compliant with what they should be doing.
that's true too.
Yeah. If you say don't walk barefoot and a person goes out, on the blacktop driveway to the mailbox to get their mail and comes back with a thermal burn,
What do you do?
well, we have to heal them. We have to try to heal them. Now, one of the other things that's attendant to this, which is really, really important, is to understand what can be done to heal the ulcers, because this is really critical. Most of the time, we can get these ulcers to heal if we can get enough what I call red gold, which is blood. If we can get enough red gold down to the wound, because blood will carry fresh oxygen and nutrients, and it will help to bring those cells necessary on an individual basis to debride the wound, get rid of the dead and devitalized tissue, and help the new tissue to come in. So in a great majority of the cases, people with ulcers are never given a consultation to a vascular surgeon. This is a sin. This is absolutely a sin. And a lot of times this happens because of greed. Because if there's an ulcer that can't be healed, I'm going to say can't be healed in quotes, you're going to the operating room and taking your leg off. But if you have an ulcer and we work it up appropriately, and we investigate every part of where things could go wrong, especially a vascular evaluation, the great majority of people that are losing legs will not have to. As a matter of fact, almost 80% of the people that have amputations could have been prevented.
You mentioned oxygenation. The red blood cells will bring to that area. Have you heard of like oxygen chambers doing well also for that kind of condition?
Yes. Hyperbaric oxygen is very well documented in the literature. And now there's I just saw this the other day on LinkedIn. I thought it was just amazing. There's a guy somewhere, I forgot where he is. He invented a gel dressing that has water in it, and he put a battery on it, and the water molecules dissociate into hydrogen and oxygen, and it puts oxygen right on the wound.
Oh, wow. That's perfect.
It's pretty slick.
That's slick.
It's pretty slick. So every day, LaMont, I read something about somebody somewhere that's done this amazing thing to help people with diabetes to overcome these problems and live a better quality of life. So vascular surgery is absolutely something that isn't done nearly enough, a vascular evaluation. The next thing is dealing with the wounds. Now, I want to talk about where the choke point of all this is, because this is really important. Diabetes is a disease that requires a specialist. When you look at the ratio of endocrinologists to adult male patients in this country with diabetes, that number is 1 to 5,000. Bad.
That's not enough. It's not
Right.
enough.
Not enough. We just talked about there's
Yeah.
not enough. So by default, 90% of people with diabetes are moved over to their primary care provider. The primary care provider is the choke point in all of this. And here's why. Number one, they're generalists, not specialists. Because of that, they don't have before I say this, I'm going to say there are a lot of great primary care providers. I'm not dissing.
Oh, yeah.
There's good people. They try hard.
Oh, yeah.
They know what's going on. So, please understand that I'm trying to talk about the issues rather than So, primary care providers don't have the education or the training on foot health, let alone on diabetic foot health. And so what tends to happen is, number one, they don't have time. They've got 10 minutes, maybe 15 minutes to see everything. And, hypertension and cholesterol and high blood pressure, those are much more sexy, than your foot. So, a lot of times they're just not going there. So they don't have time. They don't know about it. And number three, they're really not motivated. So what tends to happen is a foot exam doesn't happen. And one of the reasons why is this. No doctor has to say, gee, I don't know. If you're a really good doctor and you don't know, you'll say it because you're an honest person. But most doctors don't want to say, I don't know. So they could say, well, let me send you down the hall to Dr. Smith, who knows about what this is about, and take care of you, which would be the smarter thing for the patient. But it doesn't happen. So the patients are literally abandoned, if you will, and don't get any care. So in order to combat that, what I figured out is a way to get around that. And what I'm doing is I have a company, I'm creating software, and the software will be used by a nurse or a nurse practitioner in the office. We don't want the doctor involved in it at all because they don't want to be involved in it. So the nurse practitioner does the exam, a report is created, it goes to the doctor, and then the doctor can look at it and say, okay, the report says you should have a vascular consult, you should see the dermatologist, you need special shoes, you need lotion for dry skin, whatever it is. The doctor's in the loop. The doctor still controls it. It's not that the software says.
Which is the system today, is how it works. So,
well, you know what? Our medical system was not designed for prevention. It was designed for disease. And that is, right. And you know that.
Yeah.
And that's one of the problems, why we are having such a difficult time moving into prevention and the business part of medicine, the value-based care, which I know you know a lot about, because the system hasn't been designed for that. So when the doctor receives the report will tell them what internationally acceptable risk category the patient is in, what their unique risk factors are for developing an ulcer, provides recommendations on how to mitigate those risks, and when the patient needs to be seen again for reevaluation. So I told you when I did this myself, I came up with astounding results. And so what I really want to do is I want to bring this to the world.
That's perfect. That's a good next chapter of your life to make a difference to everybody, not just the patients you individually see. That's great.
Yeah.
Well, with your new software, that's something you're going to be working on over the next year or so and getting that out there. Tell us if people have some questions about this and want to bring this into either their practice in the future, how could, first of all, what's the company going to be called where they could reach out to, and what's a good way to contact you?
We gave birth to a company last week. It's called Averta Health. Averta Health. And we'll have a website coming up soon, and we'll be available for people. But if anybody really wants to be in touch with me about a question or a concern, they can reach me at Dr. Hinkes at Gmail, drhinkes@gmail.com.
Perfect. And then I think you're on LinkedIn as well.
I'm on LinkedIn. And the other thing is, I told you I wrote a book earlier on called
Yeah.
Okay. I don't want anybody to buy this book. Do not buy this book. It's awful. It's terrible. The paper is bad. The font is bad. The pictures are bad. Do not buy this book. But buy my second book. My second book is called Healthy Feet for People with Diabetes. It's a terrific book. I may have it laying around here somewhere.
And I assume they can buy it on either on Amazon or
Healthy Feet for People with Diabetes. Yeah, it's on Amazon. It's got nice pictures, and it's easy.
Great.
It's easy to read. And I even have a nursing school using it as a textbook.
Oh, that's great. That's great.
Yeah.
Well, Dr. Hinkes, thank you so much for being with us today and sharing your thoughts on health and how to avoid, if you do have diabetes, how to keep your feet as long as you possibly can. There's just got to be just so many things that come up with not just physical health, but emotional health and challenges that come from those physical breakdowns, which I'm sure you've seen.
Yes. Diabetes is a very tough animal. And, my hat is off to people who really, aggressively dance with that because those are the people that are going to have a good quality of life. Those are the people that will live to see grandchildren.
Yeah.
Because they're going to take good care. They know the downside and they're willing to do what's necessary to live a good, healthy life.
Good. Well, thanks again, Dr. Mark, and we'll look forward to reading your book and also see how your software evolves and makes a difference throughout the world. Thank you.
Thank you, LaMont.
Thank you for tuning in to the Fountain of Vitality podcast. Head to fountainofvitality.com for more episodes, insights, and resources. Remember, your health is yours to own. Take charge, focus on what you can control, and keep exploring what works for you. Always be your best self, lift others, and trust the compass of wisdom. Until next time, stay vibrant and take care.